Hello, everybody. I think we're live, yeah. I think the clock's ticking. So, hello, everybody. I'm Dodgy Git. Welcome back to the Dodgy Git Show. We're at 111, 111, show 111. Which way is that got to go? That way. No, this way. That way. Yeah. Show 111. Yeah. Hello, everyone. We'll get you back on old fucking Boris there. Yeah. Let's bring this screen back up. I'll pop myself up in the corner again for you. As soon as it starts, I'm keeping myself refreshed with the stream. As soon as they start, I haven't got the television set on. Hang on, let me tell. Black Mirror's fucking being a Black Mirror. Let me yeah. They'll be coming back in a minute, right? So, yeah, welcome to the Dodgy Git Show. Covered it this morning, parts 1 and 2. We're gonna try and follow on. There's a lot of people upset, and I'm not surprised. I'm upset, and that's why I'm sat here doing this, because I've utterly had enough of the systemic failure. We've all been taught now within industry how shit functions, yeah? We've adapted company structural fucking procedure and policy to be able to fucking deal with systemic issues that come up within the fucking business, right? You're running a fucking show, yeah? Running a fucking circus, right? Any fucking shit might occur. You got to be able to deal with it as management. There's a lot of companies I'm seeing around. Don't know if it's getting some fucking advisory role, actually. There's so many fucking... I don't know how to do that either. Don't know how to fucking... there's so many companies out there. They run on just doing it. Yeah. Oh, well, we've done it like this. Well, have you written that down anywhere? If you fuck up, if somebody fucks up, how do you hold them to account for fucking up? Yeah. If you've got no way of holding them to account with documentation that they have or haven't adhered to. You can't tell somebody off for not doing something when you haven't put it in place for them to do. Yeah, so what was I supposed to do? And they say, well, you'd like I showed you. And you go, well, yeah, you might have showed me, but I don't know what that actually fucking means. Yeah, because I need to show this other guy, and I can't explain to him because I forgot a bit, because I can't remember fucking everything, because I'm a human being and I forget. That's why we write things down. That's why we fucking... And this is it. Why aren't we writing shit down? Why aren't kids taking notes? They're poking a screen, aren't they? They're only allowed one bit of paper in front of them at one time. They can't glance around the desk at fucking 15 different bits of paper. They got one screen in front of them, and they got to fucking try and spend more time waiting for it to fucking go back to the other document. By the time they brought the other one up, they've forgotten what they had to transpose. Error management. Right, here we go, everybody. I'm gonna bring you across. There we go. No, that one. No, there we are. I think we're there. Right, let me get you live. We're live, and it's Hugh Keith and Boris Johnson. Well, thanks for joining me, everybody, at the Dodgy Git Show.
And his focus is elsewhere. He thinks it'll be like swine flu, and he thinks his main danger is talking economy into a slump. There are a number of parts to that message, and I'd just like you, please, to say whether or not you accept that there is any truth in this message, bearing in mind it's dated also the 3rd of March, or whether you think there is a degree of accuracy in it.
Well, we've just had the previous day, Mr. Keith, we just had the Cobra that I've chaired. I think we're planning to deal with something that I actually think, as I've told you, is starting to be an issue of concern to me. I was, as I say, rattled by the images from Italy. I couldn't figure out why I was getting these conflicting messages about whether something could happen, the scale of the RWCS and what it was going to be. I think the part of the message that is still correct at that point is that if at that point you had asked me what is going to be the lasting damage from this, I still would have probably said it's going to be what we do to fight it, rather than the actual impact of the disease. But I was increasingly concerned about it.
You have, in fact, already given evidence to the inquiry in relation to why, you suggested at an earlier stage, there were comparisons properly to be drawn with swine flu, and you've described the importance to you of not talking the economy down. The first line, he doesn't think anything can be done. May I just ask you this? This date, the 3rd of March, comes, of course, after your meeting with the Civil Contingency Secretariat. It comes after the COBRA, at which there is some early debate about measures and what can be done. And if you did say on the 3rd of March to Mr. Cummings, I don't think anything can be done, that casts a very significant light upon what you were being told around that time.
I don't think I can't say exactly what I said to my advisor, nor would I necessarily place too much reliance on his reporting of what I said. But I think my impression was at that time that, because of what we've said about borders, because of what we said about the other measures open to us, that it goes back to the questions I was asking. I couldn't see yet the plan. I couldn't see what. So the NPIs were, to me, and this is probably what Imran is getting at in his email, pretty, far-fetched still in my imagination. I was still gestating that.
At a press conference on the 3rd of March, you said that we were, as a country, extremely well prepared. Of course, as it turns out, that was not so. But I want to ask you, the weekend before, you had received the draft action plan, the contained delay document, which you'd been shown in draft form. And in that document, there is that assertion, we are well prepared and we have plans in place, etc. Do you think you told the world that we were well prepared on the 3rd because you had seen it in that action plan draft which you've been reading over the weekend?
Yes, this is the second. This is the weekend of the
28th of February, 1st of March.
Was it a leap year? Was there a 29th?
I really don't know, Mr. Johnson.
There you go. Well done, Boris. Yeah, spied that one.
It's certainly true that.
See what his brain does.
I was
thinks about the fucking odd thing, doesn't it?
Reassurances I was getting were that we were well prepared. So the scales had not yet.
Who told you that? Who told you that? Was that Matt?
For instance, test and
trace.
Was
that Matt? And who told Matt? Was that Chris? Who told Chris? Was that Fauci?
You shook hands with patients at the Royal Free Hospital on the 1st of March.
Shares and stuff,
you know that, of course, you were later criticised for that. May we take it that you hadn't seen, or at least you hadn't been advised of the contents of the Spy B paper of around that time? In fact, the paper came later, the 3rd of March, but advice was given generally before that, advising against greetings such as shaking hands. Did you know?
I didn't, but I do think that it was. I shouldn't have done that in retrospect, and
more hindsight.
I should have been more precautionary. but
More
I
due diligence.
wanted to be encouraging to people, and so I think it's
Fair
on
enough.
that day that I go to Colindale
Fair enough, Boris.
to PHE, and although I've been told, sorry, this is in my statement, but although I've been told that
Who told you that?
we have a fantastic belt and braces system, I was a little bit concerned about. I had a feeling that perhaps they weren't really as across the situation as I've been led to believe.
Mr. Hancock gave evidence to the effect that he was told on the 18th of February
The lads, man.
by
I
Public
can
Health
feel
England
it,
that the
man.
test system was unsustainable,
Fuck
that it
you.
wouldn't be able to operate beyond the handful of first few hundred cases. Did you know that
Unsustainable.
when you visited Colindale?
No, and in fact I think I gave a clip to the media, which I gave some figure for the number of daily tests that I believed that we were doing, and I do remember Chris being CMO, being quite
Right, listen to
sounding
Boris on a podcast
confident,
for
at
a
least
sec.
to me, about the number of tests we were capable of doing at around that time. I now I can't remember the exact
All right.
date.
Cobra on the 4th of March, you chaired that. You were presented with a paper, Potential Impact of Behavioural and Social Interventions, 56158. Again, it's illustrative of what you were being told at the time, Mr. Johnson, because it makes plain that behavioural and social interventions can be applied as part of an HMG response, including the expected impacts. The note doesn't cover economic, operational, policy considerations. SAGE has not provided a recommendation of which interventions or package of interventions the government may choose to apply. So the first question is, did you understand that SAGE was never going to be telling you, Mr. Johnson, you must do this? It could only ever provide advice about the nature of the interventions and the consequences and the risks and so on. It could never tell you what to do or what you had to consider doing.
That's right. I mean, SAGE is like it's a doctor-patient relationship. The doctor can't order you to do things. The doctor is not responsible for what you do. The doctor says, if you do this, then that. If you fail to do it, then the other, and that's basically how it works and should work.
Was the Chief Medical Officer around that time, the 4th of March, telling you, however, you must now start considering these behavioural and social interventions? And of course, the first one, you'll recall, is imposed on the 12th of March.
Yes. So
we don't know when you first started to.
So as I said before the break, actually the CMO and I had a heart-to-heart about non-pharmaceutical interventions, about a lot of aspects of it, particularly from a public health point of view, the costs, and he really stressed that. So we had thought about it, and I could see that was the direction in which things were starting to go. And it's only a few days later when I actually tell the public, I think for the first time, I think it's the 9th or thereabouts, we're going to have to start restricting social contact.
And that answers perhaps my next question, which is, why was there a delay between the first debate between you and the Chief Medical Officer about the possible imposition of these behavioural and social interventions and the 12th of March, when the first really significant intervention was imposed?
I think that
So I really want to talk over all of this lot and interrupt them all with pretty much everything they're saying, but I also want you guys out there to understand how he got to where he got to. So I hope you get that. I'll leave you to it for a sec. Swing and cup of chat.
By going hard, going early, which later became the mantra, but which in March the problem was that if you, so I was told repeatedly by both CSA and CMO, you risked bounce back and behavioural fatigue, and yet more behavioural fatigue as a consequence of bounce back.
There's a graph on page 2 of this document which shows what the waves, that's to say the transmission of the virus, would be likely to be, depending on whether or not there was mitigation, that's to say intervention, or no mitigation, or moderate intervention. And you can see the different colours of the graph of the lines, Mr. Johnson, depending on whether or not they were very stringent or less stringent. So it was plain to you, wasn't it, that if no steps were taken, there would be a massive first wave. That's the black wave. But if it was reduced to some extent, there would be moderate transmission, the blue wave, and then a more severe intervention would be the high transmission reduction. But to make absolutely plain, if we look at page 5, there was at this stage on the 4th of March no mention of a lockdown as such. There were a range of potential interventions, from stopping large events, closure of schools, home isolation, whole household isolation, social distancing, impact. We can see there on the right.
All these things.
Right, but no lockdown.
No, and that's quite right. So this is the sort of the double hump graph that really became very influential in all our thinking, and indeed is what, I'm afraid, tragically, is more or less what happened. But the measures that we could take to depress the first curve, first wave, were all very much couched with caveats about timeliness and not going at the right moment.
And it's right to say, isn't it, that so the wording that the Chief Medical Officer used with you and spoke in Cobra on the 2nd of March must not be implemented too early was with reference to interventions, plural.
Yes, and if I could offer a suggestion as to what was really going on, I think that, and it is clear, we simply didn't realise how fast the disease was spreading, and if you remember, the predictions were that the peak was going to come in mid-May or June, I think, and it was really well in advance of that.
If we go back to page 2 and the graph, you can see that it's put there in terms of spring, summer and autumn.
Yeah.
But there was no suggestion on that graph that the peak of the black unmitigated wave would be the end of March or the beginning of April.
That's correct.
Speeding up now, because we're coming now to the final decisions in March. WhatsApp messages from Mr. Hancock, or rather his WhatsApp group, the WhatsApp group he shared with Mr. Cummings and Mr. Slack, suggests that around this time on the 5th of March, they debate telling you to stop saying business as usual. Did you recall that debate with them?
I don't, and nor do I even remember saying that, but using the phrase.
Can't remember this.
But I think what I might have said is, until such time as we tell you to do X, Y, Z, it's business as usual. But I don't remember that debate.
You've described the genesis of the herd immunity debate. May I just please show you a WhatsApp entry or WhatsApp communication from the 14th of March, so running forward a bit to the weekend, at which there was a distinct change in strategy.
After we just
if we could just look at the 14th of March, 7:17 a.m. So I think it's page 3 of 48399.
In the morning of the 14th.
We can see
early-ish.
I'm not sure that's.
Come on, whoever's pressing the button.
Document 483.
Come on.
99. Oh yes, it is.
Oh yes.
Thank you very much. So just to put it in its context, Mr. Johnson, over the weekend, at which there was a change in strategy, there were repeated conversations between you all, of course. But you raised at this point the point of the the impact of a herd immunity debate. And you make the point further down the page, I think it's at 649, 39. Yes, here's the problem with the herd immunity argument. So just very shortly, you described to the inquiry how the herd immunity debate arose at the beginning of March, the 5th of March. It appears that you were still debating, or your advisors and you were still debating, the full meaning of and the nature and the extent of the herd immunity debate as late as the 14th of March. It appears to have trundled on as a bone of contention for weeks.
Holiday, wasn't it?
I think I can understand.
Yeah, I know, they're still skiing. They'll be back Monday. No, they're going on Friday.
Let me try to explain what I think this is about. What happened on the 12th of March?
It's like your child being in school 12% of their life.
We were trying to deal with the
88% of it. They're at home with you.
I had to level with the public and say, I'm afraid a large number of people are going to lose their loved ones before their time, and it was a pretty grim press conference. And in that discussion, we were asked about
may as well have declared war in, yeah?
And I think Patrick said
bring up someone
the
else's
idea
name.
was to flatten the curve, suppress the virus, with some measure of herd immunity by September being, I think, a good outcome, was what he said.
So we come up with a curve thing and about good outcomes. Well,
I think he also said something to the effect of it might not be.
Welcome to the dodgy Boris show, the dodgy
suppress the curve
with Boris.
But not. It might not be necessary to stop everybody, or even desirable to stop everybody getting the virus, because again.
When you were talking earlier though about fucking chicken pox and what, just let everybody get it, right?
When people pick up their ears and say, are they trying to allow this thing to
come on. Where's my chicken
pass through the
pox?
population?
Where's my chicken pox party? Come on.
With a view to establishing herd immunity, which was not
have a kids' disco for fucking 8-year-olds spots,
and we had to
rub them all together.
Do quite a lot of work to clear it up.
That's it. You dance with it. Yeah, you dance with them. Yeah, you dance with them. Yeah. Oh, that's it.
Our objective was to protect the NHS and save life, and to save life by protecting the NHS. That was our objective. Our strategy was to suppress the curve and to keep the R below 1 as much as we could. We were going to use everything we could to do that.
And who was telling you that's what you needed to
was
do,
going to
or
be,
that's what
we
the
hoped,
facts were, or what?
A byproduct
Where was that coming from, and who was feeding them?
Campaign which might be very long and very difficult.
At the same time, in Cobra on the 9th of March, in Sage on the 12th of March, in Cobra on the 12th of March, and in an interview that the Chief Medical Officer gave to the press on the 13th, there were repeated references to the need to delay the peak of the virus as opposed to suppressing it entirely because of the risk of an uncoiled spring of it bouncing back.
Yes.
The second
Roll it
wave.
out instead of letting it peak and trough.
If you could just have that document back 48399 and
Whose idea was that?
7:39:42 a.m. please, the 14th of March. Probably page 3 of that document, 48399.
48399.
It appears that this debate about herd immunity and the debate about uncoiled spring had caused you considerable concern. Because at 7:39:42, you say that's why I was concerned when some on the team were suggesting last week that we actively need a proportion of the population to be infected. And then you say civil service need to grasp. What did you mean by that?
So can't say exactly what.
You need to grasp the fact that you're still on the chicken pox theory, right?
I think probably what I mean is, look, we've set a hare running by mistake. I think Patrick
set a hare running by mistake.
A huge job to try to clear it up.
Or is animal abuse?
We all need to set the public's mind at rest.
Oh, bugger, we'll have to shoot it.
Protect the NHS.
Bang! Oh, bugger, I missed. Let the dogs out.
Further down the page, 10:49:15. In fact, it's the 15th of March, page 6 of this document. You could be seen to be saying,
Boris.
given what's happened in Italy, we simply have no time. And,
what was happening in
this is
fucking
at
Italy?
The 15th.
Who was telling them
10:49.
that, and who were they feeding it from?
15. There we are, 2/3 of the way down the page. 15th
Italy,
of March.
eh?
We have no time. We've jumped forward, but
Or
that,
was
of
it the
course, is the
Vatican?
Sunday, the 15th of March, in the middle of all the debates that you were having with your advisors. All right. Just to finish off some other points which you've addressed. In relation to behavioural
It's a
fatigue,
star fort, isn't it, the
and
Vatican?
you
Whole
being told
Vatican
that the
City
timing
is
of
a star
implementations,
fort.
timing of implementation
Incredible.
of interventions was vital. The evidence before the inquiry shows that the SAGE meeting on the 13th of March, that's
Yes.
to say on the Friday, you
Herbs.
weren't, of course, an
What's that
attendee of
fucking-
SAGE.
That was the fucking
told-
bomb group,
and
right?
the
Boris's
minutes
bomb
of
group.
the
He
SAGE
just
meeting
called it
make this
Sage.
plain. Difficulty maintaining behaviours
in the smokers'
should not be
room.
taken as a reason
No
to
shit,
delay
Boris.
implementation. Ben Warner, your advisor, was present at that
Yeah.
meeting, and he was reporting back to
Welcome
number
to the
10.
Veggie Git Show, everyone.
Were you told that, in contrast to what you've been told about the need for timing and behavioural fatigue and so on, SAGE was in
Behavioural
fact saying on the
fatigue.
13th,
It's
don't
a
take that
thing.
as a reason to delay implementation?
Pissed off doing anything.
Well, in effect, yes, in the sense
Industry
that
shows us
that was the,
Moving us
and I wasn't
around,
told
isn't it?
that particular
Yeah.
detail about behavioural fatigue not being a reason to delay implementation. But what I was told was that we had a new data. We were at least, 5 to 7 days further on, possibly more, in the curve than we thought we were,
All right.
and that
That's
the
it.
margin of manoeuvre
Hakaloogie,
that
Boris.
SAGE had
Go on.
seemed to think we had
Flop
was
one
offering
under the
to us
desk, and it like you're
on
at
the
school.
12th. If you remember, they say then
They've got
there
to
are
block
four
those and
things
you
you
can
can
blow by those.
do. Self-isolation for 7 days if you've got any kind of symptoms.
Boris,
Though even that they say we
stop
can postpone
flopper.
to Monday the 16th. Then there's household isolation of for 14 days. Then there's a couple more measures.
Load of shit
Advice
coming out, it's all
advice for,
different, right?
the
It's advice.
for the
For the elderly, the disabled,
then
for the
for those
vulnerable, for the under
and
fucking
those
threes, for the
last
over 76s,
three, they
below
say can actually
55s,
be
over
put off
56s, fucking
for
hell.
1 to 3 weeks on the 12th.
The
Then
people
on
between
the
16 and 18
13th,
are still lost, and they.
that's the key moment, really, because that's when I get called back on the Friday evening. I come back on the
Hello,
first thing in
Mom.
the morning, and
We'll do
the rest.
breakfast day.
On the 12th of March, there was a COBRA meeting, which you chaired, 56209.
Will she find me in contempt of court?
There is at page 6.
I am in contempt
A
of
graph.
court. I totally condemn this fucking shot. Anyway,
Yeah.
we won't go there.
And
It's got
I
to be
remember
some
looking at
way to
This
have a
page
chat about it.
is
isn't it?
entitled, "What would the effect be
Fuck
on the
yeah.
NHS of interventions?" So
This is the what date is this again?
This is the 12th of March, so it's a
Yeah,
Thursday.
see, you
Now,
can catch Boris
on the
out,
right-hand side, you
presenting
can see
me shit
graph A,
like,
no measures.
Where's the
So
company
that's to say no
number at the bottom?
interventions. And on the bottom right hand
It's never on any
corner,
of those
graph
housing
B,
association
measures
websites.
1 and
is
2 implemented.
it? There's
1 and
a
2 were
fucking number
7-day
at the bottom on
isolation,
their websites.
and number 2 is household isolation. If we could scroll back out again, please. In both graphs, the red line, freeable beds, and the black line, total NHS beds, make plain that whatever you do, unmitigated or mitigated through measures 1 and 2, the NHS will be massively overwhelmed.
Yes.
What did you make of that?
I was bewildered, to be honest. I remember
Yeah,
looking
it's
at
like,
that
what
graph
the
and
fuck
thinking,
does this mean?
in either case,
Yeah,
we are facing
we're
a
fucked. Like,
an absolutely intolerable situation, and but although I clocked it,
oh right, he clocked that, right?
I
didn't
thought,
he?
well, there must be a reason why we're not being told to go urgently. Maybe that reason is all the things that we've discussed. So have to admit, and I think I say in my statement, that I think at this point there is a certain amount of incoherence in our thinking, because
No
that
shit,
graph
Sherlock.
makes it clear that things are going wrong, and that is cleared up the following day.
You didn't yourself
What the fuck?
ask, firstly,
Fucking hell,
what
Boris.
can be done to bring the blue
No.
part of the chart below the black line? Why are we talking in terms of these modest measures, which may or may not even be imposed this week, when we've got to bring the blue part below the lines?
I didn't.
And secondly, why didn't you ask? Why are you presenting me with this and at the same time telling me we mustn't go too early with interventions?
Well,
Exactly.
because I'm afraid, listening to the advice I was being given about timeliness, and I was and looking with puzzlement at the graphs, and what I should have done, and
Didn't know what to
though
do.
thankfully it was only a
He didn't know what to
matter
do.
of
There wasn't
a
a procedure,
day,
and everybody was looking at
two
him.
before the thing was resolved. What I should have done was, as soon as I saw that graph, said, hang on, this is not coherent with what you're telling me about
Overwhelmed.
timeliness, because I do remember looking at it and thinking there was something amiss.
Around this time,
There was something like what?
on the
Not
5th
enough
of March,
beds.
going
Not
back to the
enough
beginning of the week, on the 5th of
staff.
March, there was a COVID-19 meeting at which advice was given to
Not
the
enough
effect that a prohibition on
ambulances,
mass
not enough
gatherings was
fucking-
not necessary.
Not enough everything.
Did you,
So,
throughout that week,
yeah, what do you
as you
buy
had, in
masks?
fact, during earlier weeks, receive advice that
Why is a hospital
for
bed so
epidemiological
expensive?
purposes,
Not
at any
every
rate, there was
single
no
one
need
of
to
them
shut
needs to be able to
mass
fucking
gatherings, sporting
fold
events?
up into a
That
lot
was
fucking
but
transport.
to be fair to the
turns
people who
into
were
a
giving the
fucking
advice,
wireless fucking
it
stadium.
sounded
Right.
reasonable at the
Just
time.
fucking bed for
Given
someone
what
to
we
fucking
knew,
lay.
because what they said was, look, if you do this,
Can't even
what
pick
you
them
will
fucking
do
things
is push
up that they
everybody
got.
into
My God, they
into
must
the
weigh a
pubs
ton.
and the
Who's
warm enclosed
paying?
spaces where
The
transmission will
company
be
that fucking
even
makes
faster.
them.
So that was
All that
the
money.
point that was made.
Piss take.
You were, by your own words, of course,
Piss
only
take.
following the science rather than being directed by the
Correct.
science. It must have been apparent to you that this was presentationally disastrous to keep mass gatherings open whilst you were debating the closure of schools as one of the possible interventions.
That's true, but I felt that it was certainly the public didn't get it. Just as, but that was
I
true of
beg your
many
pardon,
of
Boris. The public didn't
the
get it.
measures
Fuck
that we
you,
put in place
Boris.
throughout the
Fuck
pandemic. There was often there was often a gap between the
Phone
public
calls that Fauci fucking gave
conviction
us.
about something
Right?
and the scientific certainty about the effectiveness of that measure. Borders would be an example. Masks might be another example.
You've highlighted the importance of communications, Mr. Johnson, in terms of leadership and in terms of beginning to direct the country.
All the
That
birds
there were
is in the
terribly
trees.
difficult times ahead and impossible
little
choices to
tree
be
lights.
made. The closure of mass gatherings would have sent a
weapons
vital
out.
message, would it not?
And I had already told people on the 9th, so several days before, that they were going to have to restrict social contact. And on the 12th, I had given them I think, a pretty powerful and, in many ways, frightening message about what was going to happen.
But Cheltenham took place,
And the effect,
I'm so sorry.
sort of, forgive me, the effect of that, I think, did show up in people's behaviour.
So that we are clear, the Cheltenham Festival continued the week of the 10th. There was an Atletico Madrid match.
Yes.
And mass gatherings, sporting events were not, in fact, shut
Yes.
until the following week.
Yes, and as a
Do you think that was the week
with
when it all
hindsight,
just spread like that?
as a symbol of the government's earnestness, rather than just
whatever
as
it is.
Being guided by the science.
Obviously following the science, yeah.
We should perhaps have done that, and I agree with you.
And no doubt that was in accordance with your own libertarian instincts.
Well, at every stage, I was weighing the massive costs of what we were doing to people's psyches, to people's life chances, to the whole. When you talk about an economy, you're talking about people in all walks of life who suddenly can't get to do the thing that they need to do to earn a living, and it's a what we were obliged to do was very, very destructive for a lot of people who are least able to bear the costs and least able to manage it.
Over the weekend of the 13th, 14th of March, there was what has been described by a variety of witnesses as that change in strategy. And it matters not for these purposes, Mr. Johnson, whether it was an acceleration of the existing plan, a change in strategy, or a redirection. There was, on any view, a significant change.
Write your comments in the comments box, please.
Don't forget to ding the bell,
click the like and share.
But obviously, the ultimate decision is from a lady.
Show 111. Thanks
there were a number of individuals who were pushing for change. Mr. Cummings, with his colleagues, Ben and Mark Warner, and also Helen McNamara and Imran Shafi, all met on the Friday night, and with Mr. Cummings' whiteboard, they worked out that immediate, much more stringent measures were required to prevent the NHS from being overwhelmed. During the course of that week, the days before that weekend of the 14th, 15th of March, it's obvious from data being provided to Number 10, we've seen part of it in that memo to Sage, showed the likely impact on the NHS.
But that was to Sage, and then Sage presented what they wanted.
The lead government department, the DHSC, responsible for public health, pushing you harder during that week to introduce the more stringent changes. Why do you think that department, it appears from the evidence, was still trying to go for the squash the sombrero, part mitigation, herd immunity route, as opposed to recognising we must have suppression? We've got to stop this now before it's too late.
I think probably. So my memory of it is slightly different from that account, or maybe it might be the same. But what I felt happened was that.
Come on, Boris, spit it out.
We were in a state now when we knew we had a massive problem.
Right, so
we knew we were probably going to have to act in ways that we hadn't bargained for and didn't, and were still being developed. We still thought we had a bit of time, but not very much, probably. And that was what the scientific guidance seemed to say. And if you look at that long paper by Sage on the 12th, you can see that. I quoted a bit of it. My impression, and I may be wrong about this, but my impression was that on the 13th, the radical change that you refer to is really one about the timeliness thing. And what I think Sage saw, and this is what was conveyed to me by CMO and CSA, was that the virus was now spreading much more rapidly in the UK than they had bargained for. And therefore we had to accelerate. And so I think that it was a confluence of opinion. But the people I talked to on the Saturday morning were what you'd expect. It was Chris, Patrick, Imran, Stu, my other advisors. So I wouldn't want to allow the inquiry to run away with the idea that it all would have sailed on had it not been for the intervention of Number 10. I think that Sage themselves on the 13th had seen very seriously and very clearly that something needed to be done. That was at any rate was my impression.
Until Saturday, the 14th of March, when Mr. Cummings presented his whiteboard in the middle of numerous other meetings and talked about Plan B. Until that point, no one in the DHSC has said, we're off the mark, we've gone wrong, we've got to accelerate and impose more stringent measures, did they?
My impression is that the critical moment was indeed, as you say, that SAGE meeting when I think that a number of scientists, epidemiologists, looked at the data and said I'm afraid we're off the pace here. And I think that was what happened.
In his evidence to this inquiry, Mr. Hancock said that on that Friday, the 13th of March, he called you to tell you that there needed to be an immediate lockdown. Do you recall that call or not?
I'm afraid I don't, but it's been a long time.
In his witness statement, Mr. Cummings says at page 49, during the course of the Saturday, quote, the Prime Minister asked reasonable questions, including, why aren't Hancock, Whitty, Vallance telling me this? Do you recall that discussion?
I remember them being there, but I might be.
There was a meeting, well, there were four meetings. There was a meeting with several Vallance, Whitty, then a meeting with Cummings, Reynolds, Shafi, Lister, Whitty, and a host of others. Then a follow-up meeting yourself with Mr. Cummings and the Warners. Then a second follow-up meeting, and then another meeting. You had a lot of meetings that day.
Yeah.
At one of them, Mr. Cummings says you turned to him and said, why aren't Hancock, Whitty, Vallance telling me this? Do you recall that debate?
I think I don't recall it, but what's certainly possible is that I was alluding to. I was looking with, dismay at what was happening, dismay about what we were going to have to do, and reflecting that, this was not the message. I'm conjecturing. It's not the message that I've been having
to do something, but why the fuck aren't they doing it? Why am I finding out from you? Right?
Let's have a quick look at one of the papers, the briefing on the COVID response that was put before you on the Saturday, 183889. This is the document which sets out the current plan and the proposed alternative plan. Briefing on COVID-19 response. There's a variant on the graph that you saw before, but you can see at the bottom of the page, current plan. If you could scroll back out again, we can see current plan and alternative plan at the bottom of the page. And in summary, is this correct, Mr. Johnson?
Ideas.
That weekend,
we've got what we're doing and what we might do.
There were multiple meetings. A variety of different people pushed for different speeds of intervention.
When you work for those fucking sort.
We can see from the WhatsApps that some people said, go now. Other people said, we've got to move fast.
It's compounded. We've talked about it time and time again.
A very real understanding
that
fucking more had to be done. More stringent measures had to be imposed.
Yeah? The word spinach.
Cobra would have to consider all that on the Monday when it next convened.
Yes.
4 meetings that day.
My impression was
each meeting can be spun, right?
Ben Warner and others were doing, and I don't know about the differences in views, but what they were doing was trying to take the SAGE meeting of the previous day and really give to me the logical consequences of that.
But only you could decide the strategies, and you decided, did you not, by the Sunday night when you called Sir Patrick Vallance and Sir Chris Whitty to another meeting, you decided that the alternative plan would have to be followed, and you gave, as we'll see in a moment, a number of directions as to what needed to be done.
yes, I mean, it was absolutely clear by the Saturday that we had to act, and we were out of time.
Just literally, they came up with one idea.
To what
or we
extent
stay where we are and we're fucked, or we do something.
did you appreciate by the Sunday
Out
night
of all those
that a
meetings
lockdown
and
decision,
all
a
that
stay-at-home
fucking money and
mandatory
all
order
that
was inevitable?
expenditure to
It
us
obviously
and all
wasn't
that worrying
imposed until
concern.
Monday the 23rd of March.
Yeah, and they come
during
up
the
with
course
that
of the week,
idea.
there were a
What
great
a
deal many
fucking
complex,
proper corporate
extremely complex
bollocks.
operational issues to circumnavigate.
Yeah.
A shielding system having to be built effectively from scratch. Getting hold of data from the NHS, we can see there were real issues about the preparedness of the Cabinet Office around that time. From Mr. Cummings' WhatsApps that refer to cab off being terrifyingly shit, no plans, totally behind the pace. Was it a question, A, of
So a sticky
you
biscuit
deciding that
race
there
and
had to be a
fucking
lockdown,
losing.
but that time would be needed to put it into place, or B,
Fucking
you
hell,
would start
Boris,
the
hurry up.
arrangements which
Shake
would
it
accommodate a
out of
lockdown, but that decision wouldn't
Finger
then
something
be
dirty,
taken
you
for another week.
bugger.
I think that looking at the graphs, I was reconciled, or getting increasingly reconciled.
Thought
to
it
the
was
fact that we were
bollocks,
going
right? He looked at the
to
graph
have to
and
do
thought,
a huge amount more
shit.
to suppress the
Put that over
virus.
there then.
And I
Fucking hell. Come on,
yeah.
Boris,
Just to
man, you
get
fucking
back to an early point, this was not something we'd done for a country that's been through. It was hard to get one's head round. The legal complications were enormous. How to do it, as you rightly say, Mr. Keith, that all that needed to be worked through. We had started the bill a long time ago. I mean, 5th of February we start the coronavirus bill. But I think my state of mind then is I'm now more or less in virus fighting mode. I'm thinking we this is.
Now he's panicked.
There's absolutely nothing. We've got to throw that. We've got to sort this out. And so there's then a series of things that we do.
Throw the kitchen
leading
sink
up
at it.
to the 23rd.
Yeah.
But you weren't entirely in
Got to
virus
throw everything at
fighting
it.
mood. If we look at 273, 872,
Yeah.
page 55,
Typical reaction
we
of
can see
somebody that
part of
fucking isn't
the
armed with fucking anything to be able to help
seemingly
themselves
perennial
fucking
debate
get out of the problem.
in your own
They
mind
panic
as to
throw
what should be
everything
done.
at it, including the kitchen sink. Yeah.
Mr. Cummings asks Lee Kane if you could just scroll into that screenshot. Get in here, he's melting down.
Yeah.
Richie saying bond markets may not fund our debt. He's back to Jaws mode. I've literally said the same thing 10 times and he still won't absorb it. I'm exhausted talking to him. I've had to sit here for 2 hours just to stop him saying stupid things. Mr. Johnson, you would be inhuman, perhaps, if you hadn't, in that terrible week, oscillated and backed and veered in your own mind about what had to be done. But is it fair to say that you made your doubts and your oscillation clear to those around you?
I think it was my job to address all the consequences of what we were doing and to test the policy, which I was, as you can see, determined that we deliver and get on and do. And it was, even though it was a completely novel policy, absolutely a dramatic thing to do. What he's referring to here is a conversation with the Chancellor, where I'm talking about the downsides. I'm talking about the costs and how negligent it would have been, totally negligent, not to have had such a conversation, not to have gone through with the HM Treasury the economic ramifications of what I was proposing to do, I need to do that. It didn't in any way. Just I think it didn't in any way stop us, divert us from the crescendo of actions that we took.
Forgive me, the suggestion is not being made here that you, having reached a view on public health grounds, took yourself off to speak to the Treasury and see what arguments
how's he
needed to be
twisted it
made
around there,
properly on behalf of the economic consequences that would ensue from a lockdown. It is that your own decision making, your own judgment backed and veered, and that by implication this is a poor example of leadership function. You couldn't make up your own mind as to what should be done.
On the contrary, I've made up my mind. We are getting on and doing it. We are not being diverted. I've got the Chancellor of the Exchequer with me saying that there's a risk to the UK bond markets and our ability to raise sovereign debt. This matters massively to people in this country. It matters to the livelihoods of people up and down the land. I have to go through the arguments.
It's part of the process,
and that
Boris.
is what I was doing.
At 146636, page 92, your own private secretary, Imran Shafi, recorded in his notebook that on Thursday, the 19th of March, the same day, in fact, as those communications, you said, "We're killing the patient to tackle the tumour, large people who will die. Why are we destroying everything for people who will die anyway soon? Bed blockers." Is that not indicative of the absence of consistent position by you and a clear decision that on the basis of the scientific advice that you had received, these stringent interventions were necessary?
No, it's an indication of the cruelty of the choice that we faced and the appalling balancing act that I had to do throughout the pandemic. And in order to what, if I said something like that, what I was saying
was something
which
else.
is the truth, which is that in order to drive down the virus, to stamp out the virus, you have to do things that are going to be very damaging in all sorts of other ways. It's, perhaps it's not. It wasn't designed to be publicly broadcast, but I was trying to find a way to summarise what I thought part of the problem. And I needed people.
This is fucking entertaining, if nothing else.
And I think, by the way, that
Boris. Hello, Mom.
What I hope the inquiry will be able to do, I needed people to be able to do a faster reckoning of the benefits, the impacts of the MPIs and the costs at the same time. As for the reference to so-called bed blockers, that is, I assume this is the 19th of March.
Is that written with a line there because somebody else said it, or is it just literally his own fucked up thought?
Do the March discharge strategy. And the issue there is that we're facing a crisis and we only have about 100,000 beds in the NHS.
You're a bed blocker.
And in the acute sector.
Move on over, stop laying down. We need the bed.
Sadly, many of those were delayed discharge patients, and we needed to sort that out.
Two other issues in relation to the Thursday and the Friday. On the 19th of March, that Thursday, you had a meeting with a newspaper proprietor. Mr. Cummings has suggested that that meeting, which appeared in your diary as a personal social matter, was not perhaps the best use of your time in the middle of this crisis.
Well, I can't remember exactly what happened at that meeting. It was a very brief meeting. Mr.
You end up with hospitals full of white people
newspaper proprietor in question, doubtless wanted to know about what was happening
being cared for.
to London and why where he owned and indeed
when you're in hospital, you just deemed as a bed blocker.
Informed, and I wanted him to be supported.
Foreign nurses just say,
"Oh yeah,
do not resuscitate."
I can't remember, but I'm absolutely certain it must be.
On that Thursday and Friday, there was then debate also, wasn't there, about whether or not, in light of the figures showing that the NHS in London would be overwhelmed sooner, there might have to be a lockdown for London first before the rest of the country. But that debate resolved itself, didn't it, when it became apparent that there was little point in locking London down if the rest of the country was going to be locked down, just a matter of days thereafter.
Yeah, that's exactly right.
All right. The final weekend of the 21st, 22nd of March, Sir Chris Whitty produced a paper dated the 22nd of March, in fact, called Coronavirus Summary of Strategic and Tactical Approach to the Epidemic. And that was presented to you at the second of a COVID-19 strategy meeting on the 22nd. The lockdown was, of course, ordered on the 23rd, following a meeting of COBRA and a strategy ministerial group meeting. The material put before you, Mr. Johnson, over that weekend shows that whilst there were some positive trends, the level of compliance by the population in relation to the measures which had previously been imposed on the 16th and 20th of March failed to reach the necessary 75% required to have some degree of certainty that the R number could be brought below 1. Is that a fair summary?
Yeah, that's completely right. And I remember, I think Patrick making points about there being too much social mixing in parks and so on.
Now,
who's feeding those numbers into whoever's fucking creating a
had been shut from the 20th. You had directed the closure of non-essential retail and leisure outlets and everything else on Friday the 20th.
Yes.
A few days before, on the 16th, you'd had the first set of interventions. Why, on that Monday, did you not wait to see whether or not the measures from the previous week, which had, of course, been imposed in good faith and specifically designed to bring the R below 1, which was your overriding strategy, might work? Why didn't you wait to see whether or not those measures would, over the course of that week, start to bring R down below 1, as you had fervently hoped and properly believed they would when you imposed them the week before?
Where's that data coming from?
I think that by this stage,
to have data coming in that hot and accurate, you need it to be coming from somewhere fucking reliable. So where was it coming from?
Was starting to become much more
delay on the fucking manufacture of that.
I think that the
accumulation of that data, public use,
I sensed
creation
from what I was being told about the effectiveness of the previous messages that we had to do more. And looking at the shape of the curves
just popping off
that I had seen, I thought that we'd run out of wiggle room.
Wiggle room.
And
you mean you didn't know what the fuck to do? Sorry, I'll be back in a tick.
Do what we could.
There was no hard data, of course, as to when the NHS would be overwhelmed. You are not in the position of being able to ever to being given hard data as to when that would be, because you were in the context of a epidemiological exponential curve.
And nor was it.
You could not know exactly how many additional deaths would be spared if you took the measures on the 23rd of March, as opposed to waiting to see whether the measures from the 20th would work. You just weren't in that territory. And that being so, why didn't you wait to see whether or not the previous measures should be allowed to work? You say, looking at the shape of the curves, I thought we'd run out of wriggle room. I sensed more needed to be done. That was a very, and this is the suggestion to you, a very uncertain foundation upon which to order the ultimate sanction, the mandatory stay-at-home order.
I accept that. I think that, I'm troubled by the decisions that I took for all sorts of reasons, and none of them, as we said at the beginning, were easy. I've been the government clearly, from some quarters, gets criticised for going ahead with a lockdown. And as we were discussing earlier, the very word lockdown doesn't really appear in government vocabulary until the 14th. But we did it completely on the 23rd. I think it was really a measure of my anxiety about the curve. It seemed to me that I no longer had the luxury of waiting. It was over. We had to what I was hearing from the scientists.
Come on, Boris. Stop falling over your own tongue, man.
My sense that probably they were right to be doubtful about the efficacy of the measures. I had a hunch that might be correct. I couldn't know. I thought we could know. I thought we were out of time, and we had to do everything that we could. And so that's why we went to. We closed schools on the Friday. We closed non-essential retail, and then we do the stay at home on the Monday.
But on the Friday, when you closed the schools and you shut the retail, you weren't at that stage. You hadn't at that stage already determined that there would be a lockdown on the Monday. That decision was only made in light of the information over the weekend about levels of compliance.
I think that
that's correct, isn't it?
I think that's probably true, but I think that my general sense of where we were likely to be going had changed, and I thought that we were going to have to do whatever it took.
56213, page 4, is the relevant part of a meeting of COBRA. The COBRA decision, the COBRA meeting that took place on the Monday, after you had given the directions on the Sunday night. COBRA considered whether or not that additional social distancing measure, that is to say, a mandatory stay-at-home order, should be imposed. This meeting took place at 5 o'clock on that Monday.
Hear me now, lock your door.
If you look at the current situation update in the first three paragraphs, you will see a reference to the figures for compliance being positive in part. For social distancing measures, the figures were positive and showed there had been an encouraging drop in footfall, but in some areas these were not where yet at a level that was acceptable. But park attendance, paragraph 3, had gone up by 200%. And you'll recall in the press pictures of thousands of people attending parks across the land, and queues in shops had increased. There were regional differences and there were lower compliance rates in some areas outside London. If we just scroll, and we needn't pause for long, but if you just scroll over the document, we can see there is much more detail provided about levels of compliance, the tube, and then on page 6 at the top, the chair said the measures were not to stop all work. There was work in government and other offices that must be maintained.
Let me know in the comments, isn't it? That's
the
why it's
Attorney
there.
General gave advice
Not on
on
the
the
other
matters.
ones, because they're
Some
news
points were made
shows and they'll fucking
about
delete everything,
enforcement
won't
and
they?
deterrence.
First fucking opportunity, it'll be all gone.
And 12,
Anyway,
the measures needed to be taken as social
Show
distancing is not being
111.
adhered
Thanks
to
for
at
joining
present.
me, live and direct from a UK.
It appears, Mr. Johnson, from that paragraph, that you understood there to be a binary issue. Either the 20th of March measures were being adhered to, or they were not. And if they were not, there was no option but to go the ultimate step and impose the lockdown. There was no debate in that meeting, was there, as to whether or not, to use the words of the Chief Medical Officer, the measures from Friday might yet do the job.
I think that's fair, but I want to try to explain to you why I still thought it was right to throw everything at it. And the basic reason is that I had seen from the events of the last, which we've discussed extensively, of the last 2-3 weeks that we'd systematically underestimated
Try to remember the dates
underestimated
again.
prevalence, and we didn't have any other shot. We didn't have the systems to control the virus that perhaps I believed earlier in the month that we did. I didn't know what other tools I had as Prime Minister to protect large numbers of people from this virus, and I felt fundamentally that I was out of time, and what I believed in the previous week was that we still had some wiggle room, because that seemed to be what I was hearing. I might have been wrong, but I took the view on the Sunday and Monday that we were
so did everybody else. They couldn't get in, out, or fucking anywhere else.
And the curve was too aggressive.
Aggressive curve. Ooh.
The inquiry has put this proposition to Sir Chris Whitty and also to Mr. Hancock. Did you act
Stop rubbing
because,
yourself, Boris.
in effect, you were told by the Chief Medical Officer and the government's Chief Scientific Advisor that the nature of the exponential growth was such that, regardless of the actual number of NHS places, regardless of any data that might indicate that the NHS would be overwhelmed or when it would occur, and regardless of the number of additional deaths that would be caused if you didn't act, the nature of the exponential growth was such that huge numbers of additional deaths and collapse were inevitable at some point, and you simply couldn't gamble that they would not eventually occur. Is that the nub of it?
I
couldn't gamble on not doing anything, being seen to not have acted.
To Chris and Patrick.
Yeah?
And
See,
it felt to me as though they were basically
if
saying
they act, they fuck up.
The UK was now in a position where we had to do everything we could to restrain contact, and that was our best shot
at failing.
At protecting the NHS and saving life, and so that was what I did.
Can I interrupt for a second? Forgive me.
I'm so sorry, Millie.
No, it's just you mentioned earlier, Mr. Johnson, about how some were saying we shouldn't lock down at all.
There you go, failing.
When you did decide that we had to lock down, did you consider the arguments to say you should never go that far and impose that kind of level of draconian restriction on the liberty of the population?
Good question.
Did you consider the argument against lockdown, or did you?
I did.
Or was it an argument against inaction?
I didn't. I'm afraid to say at that stage I gave it pretty short shrift, because I thought that my job was to protect human life, and that is the number one duty of government. And I thought that if the NHS was overwhelmed, then the risk of truly tragic scenes in the UK of the kind we'd seen in Lombardy was very real. And thank heavens that did not happen, thanks to the amazing work of the NHS, and as I said right at the beginning, hundreds of thousands of people. But I felt I had to do what I could to give them the best possible chance, and I had no other tool, literally nothing else.
Why not? No peacetime
And is that why,
development.
Mr. Johnson, examination of
Invested in your own yacht club rather than your own infrastructural support
COVID-19
network.
strategy ministerial group meeting on the Saturday?
You've got a support network. You've got as much resilience as a fucking paper
COVID-19
bag.
strategy ministerial group meeting on the Monday morning at 9:15.
Yeah.
And of the Cobra meeting that we've looked at 5 p.m. on the Monday, shows very little, if any, debate about the countervailing non-public health argument. It's just not there.
That doesn't mean that it wasn't happening, and as you've seen a reference to it in my conversation with the Chancellor. There was a huge amount of thought going into it, but the higher objective had to be saving human life.
And it is perhaps not surprising, but within 3 days of that momentous decision, 48399, page 17, having seen an article in the press, and it's a matter entirely, of course, for my lady. You ask the extremely salient questions, although I now can't see them. If we could scroll back out.
Thanks for joining me.
Yes, please, if we could scroll back out, please. I must say I agree with every word of this week's Spectator, perhaps. Cover story by Professor John Lee. We have no idea how many COVID deaths are truly additional. When COVID fatalities are recorded, we have no idea whether it's merely present or actually the cause of death.
Listening to a
We
column
have
in a
no
fucking
idea what
newspaper.
proportion may have had the disease asymptomatically already. So we've taken these extraordinary steps without being truly sure how deadly it is. And is those expressions of doubt, Mr. Johnson, why you said earlier that the basis upon which you proceeded was one of precautionary approach in public health terms, because in the absence of any hard data, you believed you had no option.
I couldn't take the gamble with public health, but I
What of inaction?
was conscious that, you know,
Because that's
we
the
had
only
the
two
argument
options
about
he had.
the discussion about
Stay where we
behavioural
were,
fatigue that
or
takes
do
many
something.
forms. One is that the media, understandably, you know, a lot of the media.
The media.
They need
who
a
owns
proper
the
explanation
Spectator, by the way, and who is that chap who wrote that
of why this
article?
is necessary
Does he own shares
and how
in
it's
anything?
working. And they need,
Let's check that,
and I
please.
really think
People
that
sat there in the background there.
we need to, you
Why
know,
not?
there is still work to be done in this area. And so here I'm saying,
What does that fucking
you know,
mean, eh?
we need
There's
to,
always work to be done. It's
if we're being
continual
attacked
feedback
for,
constant improvement,
you know,
right?
not
Constant
standing up
improvement
our
for
actions,
continual
then we need
improvement.
to substantiate
Point
it.
is
We need
to
to say,
move
no,
forward.
this is what public health requires.
No.
And
Is that on a
so
step
on
yes, no
this
graph? Is that 3 no's in a row? Where does
essential
that
issue,
take us to? Is it not a no, yes, or a no,
the
yes,
inquiry
no,
wants
or a
to ask
yes,
three
no, or a
direct
fucking
questions.
yes, or a yes, no, or a no,
Firstly,
yeah, get me?
From what you've said, Mr. Johnson, and this may be entirely obvious, was it your position that the lockdown measures, the stay-at-home mandatory order of the 23rd of March, was absolutely necessary?
I believe that it was.
From what?
And I
What was being told?
believe that it
From?
helped to suppress the R.
For me.
I
After
think that it
Chris?
was cumulative.
Chris and Matt, wait, hey, Chris
I
and
think
Matt?
that
Chris
the
and Matt
R
said
started
so.
to go down as a result of a series of things that we did, and also, frankly, as a result of popular anxiety about COVID anyway.
Oh, popular anxiety.
But
Popular
I've got to tell you, in all
anxiety. Who was that? Gossip, right?
honesty, I
gossip.
can't. I find it difficult to quantify the impact that those
So
measures
listen
had.
to the read the newspaper
And
and listen to some gossip.
The more
and
we
two
can
blokes,
do
one of
to,
which who was having an affair with somebody else in the fucking
explain why
background
NPR
anyway.
is, why
And what was the
NPR
other
of
one
any
doing?
kind work, why they're necessary
shares and
to the
shit.
satisfaction of everybody, the easier it will be
Welcome
for
to the
government
dodgy git
next
show,
time,
everybody.
and
Be kind, be happy,
the more public buy-in there
eh?
will be.
Is that a
Public
reference-
buy-in was, I think, already very high, but I think it would be a great thing.
Is that a reference to objective analysis of life quality and the outcomes, in terms of life and death and quality of life of particular measures?
Yeah, I think that what we all need. So I think that you asked, did the lockdown work? Do I believe that it worked? I do, but as a layperson, I would like that. And I saw the Royal Society study on this that I think Chris had a hand in generating. It was very interesting, but I think we need to understand with a lot more granular clarity exactly what these NPIs deliver.
I think that was Sir Patrick Vallance's predecessor, but it matters not.
Oh, forgive me.
Is that the report into what the nature of
interventions
are?
It came out after the pandemic. It was
indeed came out just before this inquiry.
That's right.
All right, and on that first proposition, you accept, of course, that because the government did not wait further to see whether the measures of the 16th and 20th of March would work, we will never know.
Yes, but I had got to, and I suppose that's scientifically, regrettable. But I thought we had no time to fight. We couldn't wait.
The second question: do you assess that if the government had acted sooner, had awoken to the true nature of the crisis and the seriousness of our position, and had imposed the measures of the 12th, 16th and 20th of March earlier, when the degree of viral transmission in the country was lower, that is to say there was a lower prevalence, then the need for a mandatory stay-at-home order, which of course was on the cusp of the decision-making on the Monday, the 23rd of March, might have been avoided?
Well, that I have to say that I doubt, but I don't know. I think that the virus is extremely contagious. I think that it was going to describe a pretty nasty curve, almost whatever we did. I'm not certain that we would have been able to avoid the extreme action that we eventually took by acting a few days earlier. But I would defer on that to scientists.
And the third proposition, based upon, in part, the evidence from some of the scientific witnesses who have given evidence in this inquiry, on the premise that the lockdown was necessary on the 23rd of March, was it nevertheless imposed too late? Could it not have been imposed earlier had the government been rather more alert in middle to late February and in early March, had it not been blindsided to some extent by the debates about herd immunity and not going too early and behavioural fatigue and so on, and understood properly the data in its possession, thereby allowing it to impose the lockdown in the weeks of the 9th or 16th of March?
I think that all your conditionals I would delete, except the one about the data. I think that was the key thing that that Sage lacked, and it was the sudden appreciation that we were much further along the curve than they'd thought. We weren't 4 weeks behind France or Italy. We were a couple of weeks, maybe less, and they were clearly wrong in their initial estimation. We were clearly wrong in our estimation of where the peak was going to be, and so that penny dropped. That we realised that on the evening of the 13th into the 14th, and then we acted. But I think once we decided to act, I think it was pretty fast from flash to bang.
Perfect timing, Mr. Keith. We'll take a 15-minute break.
Yeah, we'll have a 15-minute break, everybody. Thanks very much. I'll just shove myself over here for you. They've all gone off again. Well, what do you think about that, eh? How do you think he answered those questions? Yeah? How do you think he answered those questions? Quite a lot in there. Yeah, lots of different timing. But you could see the sort of the thought process and the way they were working together or not, yeah, amongst themselves. Yeah, it's it is intriguing to see live the dysfunctionality of what is supposed to be the top of the fucking country. But absolutely, hang on, this guy has gone through how much education? Right, now there's some people out there who got lots of money, and they're footballers and this, that and the other. They put their kids through private schools, don't they? And they pay a fucking fortune to have their kid totally disconnected from their life and shoved in a so-called superior school. Yeah? Because the footballer grew up on a fucking housing estate or some shit. His fucking mum had fuck all. He was a single fucking parent family and a fucking, I don't know, drug addict father or whatever. Right? Fucking community riddled with fucking shit. So he's paid for his fucking beautiful kids, elegantly fucking turned out children, yeah, to fucking private school to grow up and learn to be fucking eloquent human beings. But when they fucking turn out to not be able to use the skills they're given and listening to fucking what? Bits of paper shoved in their face. And it's literally, he got to the thing, he looked at the graph and he went, right, so we're fucked or we're fucked. Well, what should we do about it? And they had a big meeting with loads of people and everything else. And what happened? They come up with, we can stay doing what we're doing. And this is the what do they call that? Slowly catch a monkey. Yeah? Oh, you can either do nothing, Boris, or you can do something. Oh, well, I can't be seen to be doing nothing, so I'll have to do something. What's the something I can do? Oh, well, you can't do that, Boris, and you can't do that, and you fucking definitely can't do that, so we'll have to do all this other stuff instead. Oh, right, well, we'll have a meeting about it and we'll vote on it. Oh, right, yeah, do you disagree with everybody now, Boris? Boris, are you disagreeing with everybody? Oh, well, no, well, yeah, I suppose that's the best option, isn't it? That we've all agreed on. Yeah? It's actually fucking based on complete fucking bollocks. Yeah? I fucking had enough of these fucking corporations when they started fucking having serious fucking or meetings that had a huge fucking effect on the way the companies fucking run. And yes, and they are valued and you should be valued, but there's a system for it. And there should be there's a hierarchy of power within a fucking, in a company. And however fucking wonderful and brilliant the fucking cleaner is, or the fucking lady that fucking works in the coffee shop or the fucking kitchen, fucking doing the dinners for fucking lunchtime, or whoever fucking, the chef, the bloke that cooks the fucking bacon in the morning for fucking people's rolls and shit like that. They're fucking fantastic people, right? They're great at what they do. They do not need to fill their brain or have their brain concerned with fucking top corporate shit that fucking is fundamentally to do with the fucking underlying security, the fucking future of the project. You got people talking about next week. I'm talking about fucking 30 or 40 years worth. Yeah? They go, oh, well, we only made one. Why did you make one? Oh, well, you only ordered one. You only fucking ordered one. I ordered fucking 40 years worth of support. What the fuck are you doing? Yeah? Resilience and fucking resilience to fuck all. Anyway, fuck knows who was there in Whitehall. Yeah? Shunting people like fucking Whitty and fucking Hancock to positions like that. Fuck knows what Whitehall are doing on the fucking, they're like a fucking add-on on the side, aren't they? Yeah? Anyway, you got 10 minutes or so, right? Go and have a whittle, come back for part 4. Ding the bell and you'll get a ding when I come back. Yeah, won't be long, 10 minutes or so. We could sit here and chat, but yeah, we could sit here and chat for 10 minutes, I suppose. Chat about Boris, chat about Hancock, chat about how to change the fucking system. There's obviously no flow chart or decision making fucking support. Yeah, surely that's what Whitehall should be doing. But to send Chris Whitty and Halfcock, it's like, what are all the military blokes and women, yeah, and fucking ABC clubbers, because there are lots of those in the military, yeah, fucking good people, yeah, they're fucking qualms at you. Fucking, what are you doing? Yeah, I had a fucking sit down dinner once with a fucking military lady. Yeah. Told her about swarms. Then we had Ukraine war. Anyway, I'm gonna pop off for a bit. Don't forget, ding the bell and share the love. I'm Dodgy Git. This is Dodgy Git Show 111. Be back in a minute with 112. Yeah, there's fucking something in that. Yeah, show 112 coming up in about 10 minutes. I'll see you then. Share your love around to all the people you meet. Yeah.